Good morning, Sitaram, and welcome again to part two of this program. I have been speaking about the challenges that women in particular face when they have to deal with an alcohol or drug problem. And I want to remind our listeners that this program is being recorded and it will be posted on YouTube and Facebook at the end of the program in a few minutes. So that those of you who are unable to stay with the entire program at this point, you can go back and listen to it in detail. And if you have questions, you can call me at 671-3040. That is 671-3040 at any point in time and after the program, and I will be able to respond to any questions or comments you may have. The program is also repeated on the same media platform at 10 p.m. tonight. So those of you who are at work at this point in time, you can listen to it then. And you can also send this link to anyone who you think may benefit from the content of the program. Because I know a lot of people are reluctant to call the program live or do not have that access. But because of the nature of this disease, especially the subject matter I'm talking about this morning, women in particular, they can access the program. And there are many, all the programs that I've been doing on this media house are listed in Facebook under TV Jagriti, Addiction and Recovery, or Ramnaresh Dwarika, Addiction and Recovery. You'll find it on Facebook or YouTube. And there's a lot of content there on various aspects of alcoholism and drug addiction that you may be able to use for your own edification and to be able to refer others to. So coming back to the whole subject of alcoholism and drug addiction when it relates to women, as I said, it is highly stigmatized. Women are a lot of times misunderstood even by close relatives, and they are blamed and they are scapegoated because of their drinking and drug use. And as a result, they are unable to receive the kind of support, and even in the society, there are not sufficient resources available for treating with women's issues when it comes to alcoholism and drug addiction. I know there is the New Life Ministries now who has opened a center for women in Santa Flora. And there's also the Serenity Place, the director of that place, Dr. Ms. Beverly Mawson, was on my program not too long ago. And that is also a voluntary center for women. It's called Serenity Place, and it's located in Guapo Village in Point 14. And those of you who may have a problem, who want to get more information about these facilities, you can call me and I will be happy to give you the information. I also want to let women out there listening, our sisters who are listening out there, who think they may have a problem with alcohol or drug addiction, you can call me in confidence and I will give you the information, because now there are meetings, Alcoholics Anonymous meetings, that are held online. And there are meetings in several parts of the world and indeed in Trinidad every evening. And I can make that information, the password and the identification number of these meetings available to you. So you can remain in your home and attend these meetings. And I know I often attend these meetings myself in support of people who have referred there. And I know that now there are much more women, young women, who are attending these meetings, who discovered they had a problem or realized they had a problem with alcohol or drug addiction, and they are now years sober. This really started to pick up during the pandemic, and it has been a God's blessing that today women are able to get help in a very confidential manner. And because I know in the past when I would refer women to go to Alcoholics Anonymous, they will be very reluctant. Their family will even be very reluctant to have them go to the meetings, because the reality is that in AA, the physical meetings in Trinidad and Tobago and worldwide, you'll find it dominated by men. And it is not a comfortable thing. I could imagine for women to go and sit in a group that is almost predominantly men, where sometimes there's not even another woman. And to sit in there first and even present yourself there, that meeting for everybody to, especially if it's in your community. They will, I mean, I found it very difficult for a man to face those challenges. You understand? I could imagine, well, imagine how it is difficult for women to make that declaration, especially in their communities. So now we have online meetings so that one can attend from the comfort of their home. And in the online Zoom meetings, you don't even have to put your picture or your true name. You can use a mnemonic, you can blank your screen, turn off the video, and you can listen to the meeting and you can stay sober. However, I must say while it is not easy for anyone who has become dependent on alcohol and drugs to be able to stop suddenly. Sometimes some people, because if they've been using it for a very long time, and especially if they have been self-medicating. Let me explain that. Like the person I spoke to this morning had become dependent on drugs to help them to sleep. This person went through a divorce, a separation, and that might have triggered it. And that in itself, for average folks, is a difficult experience to deal with in life. To be separated, especially if you have a family, and to deal with divorce in Trinidad, we call it tabanca. A lot of people turn to alcohol and drugs because of the the emotions that are involved in separation and divorce and all of that, especially if there were instances of infidelity and rejection and all of those things. I do marital counseling, so I'm familiar with this subject. So that a lot of people might have gone to their doctor initially because they were going through some difficult emotional crisis in their life. Not only divorce, a lot of people sometimes lose a loved one. Sometimes they have a failed business attempt. Sometimes they may not have succeeded at at their profession, maybe in their studies. And there's a lot of incidents that can generate very, very strong emotional feelings that could lead to anxiety or depression. And so that a lot of people go to the doctor seeking help if they can't sleep. And generally, they will get prescribed some kind of barbiturate, some kind of sedative. And I must say, the ethics of the profession suggests that these psychotropic drugs should only be prescribed by a psychiatrist. But I know from living in this country that, and from my own experience and working in the medical fraternity, that psychotropic drugs are prescribed by even the general practitioners, and even at the community level, people just suggest you look, go and do this, go and buy that. I've heard people suggesting to people at a funeral, girl, you better take a sleeping pill, to tide you over. And some would have gone to the doctor to get a few, or the pharmacist. And these are really an abuse of drug in a way, because it is not the correct thing to do. And these are the situations that would introduce a lot of people who would eventually become dependent, because these little innocent looking tablets can make you dependent in a matter of days. Because dependence is not only physical, it is psychological. And if you take it once and you realize it worked, it might have helped to tide you over for the funeral. Then when you have other situations that is challenging you and stressing you out, you would remember, we have memory, and a lot of people go back to using it, and then it becomes habitual. So that a lot of people who have been self-medicating from psychotropic drugs prescribed for them eventually starts to supplement it with alcohol and other illicit drugs. I am seeing a lot of those people in my practice now, who have double addiction, where they are addicted to psychiatric drugs and they're using it in conjunction, because the psychiatric drug is not potent enough now, because They have developed tolerance. They are now supplementing it with alcohol and marijuana and other things. And I'm telling you, I've said it several times on this program, that that could be fatal, because when they produce these sleeping pills, they tested it on normal people. They did not do the test to, to determine the potency and strength of it by testing it on alcoholics and drug addicts. They tested it on normal folks, so that a normal person who has never used sleeping pills before would find with 2 milligrams they could sleep for days, because it is very effective with them. But for a person who has been drinking alcohol for a very long time, me for instance, you probably have to give me a dose that would probably be enough for an elephant, because I have become hard-headed. Once you have been drinking and using drugs for a long time, you develop tolerance, and so that normal doses will not work for you. And that is the problem that I hope my sister is listening this morning to the program, because this morning when she got up, in spite of all her efforts going to see a psychiatrist yesterday, she still took a drink. So I told her, in fact, tomorrow I have a very important World Hindi conference to attend, but I have put that aside, because when an alcoholic or a drug addict decides they want help, it is critical that they get it immediately, because you never know under the influence what people can do with themselves. You understand? And one day in the life of an alcoholic is a lifetime. So that I know Alcohol Anonymous have a policy. They have that whenever anyone anywhere reaches out for help, they want the hand of A to be there right away. And for that, every A member is responsible. So too in it, and this is why it is critical in every society that we have resources available. An alcoholic cannot wait till Monday or next week or next year to get help with their drug addiction. If they decide they want to stop today, they need to have somewhere to go right away, so that they can be detoxed. Because it's not every day an alcoholic or drug addict wakes up and become willing to do something about it. A lot of people drink and use drugs way into the gates of hell and insanity and even death, because they did not have sufficient insight or motivation to do anything about it. And even when they had sufficient insight and motivation, they did not have access to a facility. So I want to let all our brothers and sisters listening out there that we are very fortunate in Trinidad and Tobago, that we do have, albeit it is not sufficient, it is inadequate, but we have treatment facilities available. There's the Substance Abuse Prevention and Treatment Center at Cora. Their clinic is on Thursdays. You just go there on a Thursday morning and they will do an assessment. And if they have space, they'll admit you right away. If they don't, they'll put you on a waiting list, or they will enlist you in their outpatient program. We also have about 120 something Alcoholics Anonymous groups available that are having meeting every night in Trinidad and Tobago. And all one has to do, call me after the program. I'll give you the information. Depending on which area you live in, I can tell you where the meeting places are. Or you can call the General Service Office, which is located at the BC, near the BC factory in California. And they will also give you the information. We also have voluntary organizations in Trinidad and Tobago who offer their services. There's the New Life Ministries at Mount St. Benedict. They also have a center for women in Santa Flora. There's Rebirth House, that their office is on Charlotte Street in Port of Spain. They have a center as well. I spoke earlier about Serenity Place, which is in Guapo, Point Fortin. I can give people the reference information. There is also Heal House in central Trinidad, which is, I think, near Carolina Village there, Presal, that are also helping people who are alcoholics. But I think this center only treats men. And of course, there's so many other professionals like myself who are out there who, if I know a lot of people, because of the stigma associated with this disease, they do not want to go to public institutions. But there are also practitioners that you can contact and you can get help. There are counselors, there are psychologists, there are psychiatrists who are able to treat with this problem. But I'm saying that anyone, yes, initially, sometimes you go and you are prescribed a sedative to help you to deal with the withdrawal symptoms, or if you were depressed, if you have been using drugs for a long time, when you stop, you'll have trouble to sleep. You develop insomnia. Some people become depressed. Some people become anxious. These are all classic withdrawal symptoms of alcoholism and drug addiction, and for which, if you went to a psychiatrist or a doctor, you may be prescribed a sedative. But these should only be for a very short while. The professional need to contract with the patient that, look, I'm only going to give you this for a few days, but you cannot continue to use this because now you'll become dependent on this. The problem is not the doctors or the psychiatrists. The problem is really with the patients. You know, once you use something, it's embedded in your memory. And the patients themselves eventually do not go to the doctor or the psychiatrist, they go to the pharmacist. And there are some unscrupulous pharmacists that are operating like rum shops. I say that without any apology because they sell these psychotropic drugs under the counter to anyone who comes to buy. It's like a business. So, for your own good, please do not become dependent on these drugs. It is 100 times more difficult to come off psychotropic drugs when you become dependent on them than to come off the alcohol, the marijuana, the cocaine. It is difficult to come off alcohol addiction when you have become addicted to alcohol, marijuana, and cocaine. That is difficult enough. But when you go and become dependent on sedatives, sleeping pills, anti-anxiolytics, or antipsychotropic drugs, and all these psychotropic drugs, sorry, it is several times more difficult to come off those because they are much more potent than the alcohol and the other drugs that you've been using. So that, yes, but it is not impossible to come off. I have been using acupuncture, auricular acupuncture, to help people to come off these psychotropic dependencies. As I said, I've treated doctors and help people who are working in the field of the health professions. Because when you have access to it, you're more likely to use it. So that I want to let all our brothers and sisters listening to this program this morning to know that help is available. And there's no one who has gone just so bad, as we say in Trinidad, that you can't stop. In fact, the more bad you have gone, in recovery circles, we call it hitting bottom. Most people will not want to stop until they hit rock bottom. So that for family members, sometimes we have to allow our brothers, sisters, siblings, friends to hit rock bottom, or sometimes we have to aggravate it, cause them to hit rock bottom by not supporting and enabling them to continue. And how we do that? By enabling them to suffer the consequences. This is the one illness where care can literally kill the patient. This is why you have to use something called tough love, meaning you have to allow them to suffer the consequences, and that is what will eventually bring them around to deciding to stop using the drugs. So I'll say this again: no alcoholic or drug addict is going to stop using drugs unless to continue using it becomes more painful than stopping. So the family members and friends and the boss and all of that has to make continue using it more painful for the alcoholic than stopping, because to stop for a person who has become dependent is very painful. But you can, with support, with counseling, acupuncture, and the support of the family, the support of a group like Alcoholics Anonymous, your church, your temple, you can make it. So I see we have again run out of time. We are coming to the end of the program. As I said, this program will be repeated again tonight at 10 p.m. on this platform. It will be posted on YouTube and on Facebook for those of you who want to go back again and look at it or refer it to someone else needing help. I want to thank those of you who are listening. Again, reaching out to my own family down there in San Fernando who are mourning the loss of our sister and mother. Again, I'll be seeing them this evening. So I want to thank you all and remind you next week, Thursday, again at the same time, same station, we will be talking about addiction and recovery. Thank you and Sitaram.